Hi guys, we are Group 1 and today we will be introducing you to the types of burns and the first aid to be given in those situations. Burns are one of the most common household injuries, especially among children. The term burn means more than the burning sensation associated with this injury. Burns are characterized by severe skin damage that causes the affected area's skin cells to die. The degree of severity of most burns is based on the size and depth of the burn. There are mainly 5 types of burns. They are radiation burns, electric burns, thermal burns, friction burns, and chemical burns. Come on, let's see the first type of burn and the first aid to be given in this case.
Radiation burn. A radiation burn is a damage to the skin or other biological tissue and organs as an effect of radiation. The radiation types of greatest concern are thermal radiation, radiofrequency energy, ultraviolet light, and ionizing radiation. The most common type of radiation burn is a sunburn caused by UV radiation. Patients are advised to wear loose fitting clothing, avoid fabrics that can cause itchiness, and check with a healthcare provider before using lotions, perfumes, or deodorants. Gently washing the affected skin with lukewarm water and a mild soap is recommended as a practical step to prevent infection. Silver leaf nylon dressings can also help reduce pain and slightly lessen the severity of reactions as well as accelerate healing.
Electrical burn is a skin burn that happens when electricity comes in contact with our body. Electricity travels to our body and can damage the body organs. Electrical burns can be caused by touching or grasping electrically live objects. Burns can be caused by inserting fingers into electrical sockets. Lightning strikes can also cause electrical burns. First aid for electrical burns. Use a piece of wood like a broom handle and separate the victim from the power source. Keep the victim lying down. If the person is not responding, turn him or her on one side and call for help. Call a doctor and hospitalize the victim.
Thermal burn. A thermal burn is a type of burn resulting from making contact with heated objects, such as boiling water and fire. When things like hot metals, steam, and flames come in contact with the skin causes thermal burn. There are 3 treatments of thermal burns. First treatment. As soon as possible, put the burnt area under cold running water for main relief for at least 20 minutes. Second treatment. Burns should be covered by a non-fibrous and a non-stick dressing. Third treatment. Use hydrogel dressing for facial burns. These include water gel and burn shields, and the residue of water-based dressing are easily removed.
A friction burn is a form of abrasion caused by the friction of skin rubbing against the surface. A friction burn may also be referred to as skinning, chafing, etc. If a person suffers from a minor friction burn at home, he or she has to start by running cold water over the affected area. We can also use soap to clean the area and reduce the risk of infection as well. The person can apply antibiotic ointment and then wrap the wound area with a loose bandage. We can even take a painkiller. The person should wear loose clothes until the burn heals and should prevent any type of body lotion or powder until the wound heals.
Chemical burns. Chemical burns are injuries to the skin, eyes, mouth, or internal organs caused by contact with a corrosive substance. They may also be called caustic burns. Chemical burns can happen in the home, at work, or at school. They can result from an accident or an assault. Remove yourself or the person with the burn from the accident area. Remove any contaminated clothing. Wash the injured area to dilute or remove the substance using large volumes of water. Wash for at least 20 minutes, taking care not to allow runoff to contact unaffected parts of your body. Gently brush away any solid materials, again avoiding unaffected body surfaces. Remove any clothing or jewelry contaminated by the chemical. Wrap the burned area loosely with a dry sterile dressing or a clean cloth if possible.